I want to shoot a quickie video for you. I know I asked you guys for ideas or things that you want me to cover topic-wise in the Facebook group, and one of the things that came up from multiple people, mostly students, is how to deal with the psychosocial medical model, whatever they're teaching you in school about this psychological crap, in my opinion, which basically just deals with talking about pain. So here's our problem. For decades, we have been telling patients that it's our goal and our job to get rid of their pain. That is what has got us into this psychosocial medical model crap, okay? Our job is not to talk about pain. Our job is not to cover up pain. Our job is not to treat pain. Our job is not to give somebody a fancy word diagnosis for what their pain is. Our job as a medical professional is to figure out what the root cause of their dysfunction is, reverse the dysfunction, and the symptoms that are related to that dysfunction will go away, okay? So if we understand that, we never have to go into this psychosocial medical model junk. So when I have somebody come in and it tells me that they have fibromyalgia, or they have chronic pain, or they've had multiple injections, or they've had injections and surgery, and they're on pain medication, and they're on antidepressants and all this crap, I know that I have to unwind all the garbage that's been put in their head. Now, is fibromyalgia a real thing? Probably. To the extent that people come in and tell me that it is a real thing, not even close. And here's how I know that. Because if I get to the root cause and reverse that, guess what? All of their fibro symptoms go away. Now, you will have patients that have made their identity revolve around their symptoms and their pain. You'll have the patient who's, I just have bad knees, I have fibro, and that's their whole being. That's what they associate their self with. That's their identity. As soon as you take that away and they don't have that anymore, they actually fight to get it back. So when I have people come in and they're like, oh yeah, I was feeling really good and everything's going really well and blah, blah, blah. And I'm like, okay, cool. So we're getting past it. We're going to start scaling up. Oh, well, I don't know. It probably next month is about when I have my fibro flare up. All right. So those are the people that have completely bought in and developed their whole persona around their pain. So here's how I deal with pain when people come into the clinic. If they talk about pain, I refuse to talk about pain. When they say, well, that hurts when I do that, and I'm testing something, I'll say, forget about pain. I don't want you to talk about pain. I want to know if that feels strong or weak. So I'm going to reverse the pain talk for function talk ASAP. And I'm not going to talk about pain for the rest of the visit. And when they come in, I'm not going to ask them how their pain is. I'm going to ask them, what have you been able to do since you were in last time that you couldn't do before? Function. How is your strength now versus before you came in? Function. How much more range of motion do you have when you're reaching and doing your ADLs than you had before? Function. I don't ask them for a pain scale. That is the worst thing you could do, because as soon as you ask them that, they now think that they're coming to see you for pain. Okay, so all of this, hold their hand and talk softly, and I understand your pain, and we're going to get through this together. You just lost. You just let them tell you that it is your job to console them and chase pain when that has absolutely nothing to do with anything. Okay, so it's really easy to get around the pain discussion when you can reverse function and you direct them to think about, what can you do? What range of motion do you have now? How much stronger are you now? How much further can you run? Whatever it is, relate it to some functional measurement that they can actually measure on their own. Okay, then subconsciously they will start to reverse this pain thought process and this fibro and this chronic pain. Also, as we've gone through in this group before, and I've shown on videos before, as soon as you get chronic pain people to move in the transverse plane, somehow their chronic pain disappears. So if you let them stay stuck in the position that they've figured out is their safe position because it's less painful, they will have pain and they will be stuck, and you will be holding their hand and talking softly for years, and they will never get any better. But if you reverse dysfunction and then make them move in the transverse plane, you get them out of their protective plane, out of their guarded plane, out of the range of motion that they've been stuck in and living in, which is why their pain has persisted. So make them move in the transverse plane. Even if it's easy as just standing with their at the countertop or a tabletop and just turning the trunk while they keep their feet flat. You will be amazed at how well these people do with something that small and that easy and that basic, and their pain goes away. So instead of talking about electrical stimulation to cover up pain, and needles to cover up pain, and cupping to cover up pain, and tape to cover up pain, and rubbing things out, and lotions, and all the crap that we've been told that we have to do to cover up pain and talk softly and understand where they're coming from. No, you need them to understand where you are coming from, because you're the expert. The only thing that they're an expert on is sitting around and being miserable because all they think about is pain, because nobody's ever figured out what the root cause of the problem and then made them move through a bigger transverse plane range of motion, which gets them out of the guarded, stuck, painful range of motion. So if you have questions about that, post those down below. Also, this week is onboard or discovery calls. So if you want a free discovery call, we're not going to talk about clinical stuff like this. We're going to talk about how I can teach you how to think like this, and how easy it is to implement in your practice, and how it reinvents your career, how it gets you out of the mill, it gets you out of home health, and gets you to what you're wanting to do, which is give patients results, and then those patients turn into your marketing system, and you can open your own clinic if that's what you want to do, and you never have to spend a penny on marketing. So make sure you get to the discovery call. That link is in the post that I posted this morning, so just go to the video down below, click that link, and I will see you guys later this week on that discovery call. Also, stop consoling your patients and talking about pain.